Let's do one more, and let's flip it a little bit backwards, okay? These aren't as common, but you still will see these types of prioritization items, where instead of identifying the highest acuity or the most sick patient, we are instead going to be looking for the client that is the least sick or the lowest acuity. The nurse is caring for admitted clients involved in a mass casualty incident, and the nurse must discharge a client to make a bed available for another client. So it would be most appropriate for the nurse to recommend discharging which client. So let's look at our options. Option 1, we have a client with a contusion to the chest wall with a heart rate of 110. Option 2, soot around the nose and mouth and a respiratory rate of 30. Option 3, headache and bruising behind the ear following a head injury. And option 4, superficial non-bleeding abrasions to the face and upper extremity. And I know you guys love option 4 already, but one of the reasons I wanted to do this practice question is I've put some very high yield or very emergent conditions in this question I want you guys to be thinking about as you do prioritization items. Option 1, contusion or bruising to the chest wall. And remember, we see up here mass casualty incident, so we can assume all these clients have been involved in some sort of trauma. So if we have bruising to the chest wall and we have a little bit of tachycardia, our heart rate is 110, so it's a little bit elevated. So if we have bruising to the chest wall and tachycardia, is there any clinical condition that just pops in your brain? Anything you're worried about? So me, I was an ER nurse for about 10 years, and anytime I see bruising to the chest wall with tachycardia, there is one condition that just pops in my brain that I'm worried about. Okay, y'all are making a lot of great guesses. You know, flail chest, Chandra, we typically with that, we're going to see, you know, the breathing pattern changes. I see pneumothorax. Okay, y'all are not wrong. Pneumothorax could be the right answer. But also I'm worried about cardiac tamponade. I don't know if y'all remember cardiac tamponade. We don't talk about it quite as much. That's where that pericardial sac around the heart fills with fluid. And so that heart can't pump as effectively because it's got that fluid there. And so you see that cardiac output is going to decrease, and that patient's going to start having changes in their blood pressure. They're going to start becoming tachycardic, all these types of things. So whether it is a pneumothorax or cardiac tamponade, that is breathing and circulation up here. Very high priority needs, okay? So I hope you would not want to send somebody home that has a potential pneumothorax or cardiac tamponade. And then we go into option 2, soot around the nose and mouth and a respiratory rate of 30. So that respiratory rate is a little high, and that soot or that ash around the nose and mouth, it should be a big red flag to you guys. Anytime y'all are doing any type of question and you see that the client has soot on their face, around their nose, maybe they've coughed up sputum and it's ash tinged, that is always a really concerning finding in which I'm worried about an inhalation injury, which somebody said earlier, so kudos to you. And then Angelica, smoke inhalation, yes. So inhalation injuries are especially concerning because seeing that soot in the sputum around the face, we know they have breathed in some smoke and ash, and that is a really big irritant. So once it gets in that airway, a lot of times it causes a lot of inflammation. And this condition is so life-threatening, a lot of times we just go ahead and intubate these patients right away because our concern is if we don't secure an airway, that airway is going to just get more and more inflamed, and before you know it, the client's not going to be able to breathe. So with anytime you see soot around the nose, the mouth, or it's in the sputum, that's a big old concerning airway or breathing issue for you guys. That's an inhalation injury. So moving on to option 3, headache and bruising behind the ear following a head injury. Anytime you have bruising behind the ear following a head injury, what is that called and what am I concerned about? Basilar skull fracture. So anytime you have that bruising behind the ear, that's battle sign. That is an indicator that you have a skull fracture. So with that could be a disability issue or even potentially a circulatory issue. So option 3. So the point is, I would hope as nurses that y'all would not want to discharge home any of the clients we just talked about, okay? All of those guys require a lot more nursing interventions before we send them home safely. And then option 4, superficial non-bleeding abrasions to the face and upper extremity. I feel pretty comfortable sending them home, okay? Now, if it said they were bleeding profusely or there was any signs of decreased perfusion, such as pallor, decreased pulses, diaphoresis, I'd be worried. But in this case, we look pretty good, okay? But I hope you take away these clinical findings we talked about. That's why I wanted to include this item once again, is all these types of, these clinical indicators here are very high yield, very testable conditions. That cardiac tamponade or pneumothorax, the inhalation injury, and the basilar skull fracture, okay? We got it correct.